Hello, everyone, and welcome to Neurocracy. Today, I'm joined by Dr. Galit Levi Dunietz, an epidemiologist and associate professor in the Department of Neurology at the University of Michigan. Her research bridges the worlds of science and public health, with the focus on how sleep and circadian rhythms impact women's health, links between sleep apnea and cognitive function, and health disparities. Her work also extends into trying to make healthy sleep possible for communities. Dr. Dunietz, thank you so much for joining me today.
Thank you for having me.
My first question for you is what led you to first focus on the intersection of sleep and public health?
So it was, for me, it was a very serendipitous, the world of sleep. I was not aware of that, how sleep was important. There were very, very few sleep epidemiologists when I started. So I met on a social circumstances sleep physician, and we started talking, and he told me some of the exciting sleep research that is done in the on the population level, and that's got me a little bit interested. And then what really got me in is that he told me about studies that looked at sleep health, maternal sleep health during pregnancy, and how it impacts um, pregnancy outcomes, the maternal health, but also the newborn health. And at that time, I was working on my PhD and I focused on perinatal health. So that really got me interested. I ended up joining a project and we published a review paper back in 2014, I think. And then I applied for a postdoc in sleep epidemiology, and here I am a decade later.
Yeah. So my next question is about some of your work that highlights disparities in sleep health across socioeconomic and racial ethnic groups. Is that correct that you do work relating to that?
So, most of my work is done in women, and we
Okay.
are looking at certain racial and ethnic groups. For example, we're looking at Black women and how their sleep compares to white women. We also look at the sleep patterns of Middle Eastern women because
Okay.
they have very unique behavioral patterns and cultural practices that impact sleep, especially for those who are observant. And so we are looking at that, but most of my work is looking at women and how their reproductive transitions during their lifespan affects their sleep. So earlier in my career, I did, as I said, pregnancy. And then after that, I switched to women and how their menstrual cycle impacts sleep. And now in recent years, I'm looking at reproductive aging or transition to menopause and sleep in women. Actually, any women.
Yeah. So that's actually pretty interesting. I've actually never talked about this before, but what you mentioned about cultural practices influencing sleep, could you expand on the relevance of that a little bit and why it's important to be understanding this?
Yes. So if we if we focus on MENA women, which is Middle Eastern North African women, um, observant women have a very particular schedule of prayers
Okay.
um, that they need to that they don't need to, but
Right.
they practice, and
Yeah.
so that impacts their sleep. There's an early morning prayer, and there's a late at night prayer, and those things affect their circadian rhythms. Of course, there's also the Ramadan,
Yeah.
that it's a month of fasting, and that also the food preparation and the fasting and the breaking of the fast are all impacted by day and light and dark
Right.
light and dark cycles. So it does affect their sleep. So these things, those cultural and
Yeah.
then societal practices do affect their sleep patterns.
And yeah, I mean, the first thing that came to my mind was siestas, when you mentioned the cultural practices and how they influence sleep, because that's something interesting to think about. But I guess continuing on this train of thought, could you tell us about the free sleep clinic that you helped launch for uninsured and undeserved populations and how community-based sleep care can address disparities?
Sure. I would love to talk about that.
Okay.
So a few years ago, we applied for a grant at the American Academy of Sleep Medicine Foundation. They have a community-based grant that is focused on improving sleep on a community level.
Okay.
And so we wrote this grant because we wanted to open a free sleep clinic to people who don't have insurance. So the people who don't have insurance can be people who are working, but their employer does not provide insurance. People who immigrated and they don't have an insurance yet, or people who lost their job and then lost their insurance as well.
Okay.
And so we integrated our sleep care program into a very successful free sleep clinic in Ypsilanti, Michigan, and
Okay.
it's called the Hope Clinic. Actually, they have two different locations,
Okay.
one in Ypsilanti and one in Warren, Michigan. And so we started in Ypsilanti and we introduced the program, I think, 4 years ago already. Four
Wow.
years already. And we started with a monthly clinic, one physician, and we used the grant money that we obtained to buy equipment to test for sleep apnea, but also to treat for sleep apnea.
Wow.
And we thought that we're going to see patients that have um, different sleep disorders. But what ended up is that we only see people who have sleep apnea. Most 99.9%, the people that we see have sleep apnea. And these people are either already diagnosed and started treatment and then lost their treatment because they lost their
Um,
job, and so the insurance doesn't cover their treatment. So, what's important to know about sleep medicine is that it relies on technology.
okay.
The assessment of sleep disorders done by technology. The treatment of sleep apnea is done by technology. Even for insomnia, the cognitive behavior therapy can be done on a phone app. So
Okay.
there's a lot of technology involved, and technology costs money.
Yeah.
And when you have people who are from low socioeconomic background, they can't afford that. So what we do is we diagnose them if needed, and then we provide them treatment for sleep apnea. And when we do that, we actually see that their chronic morbidities, because these people have commonly other diseases, right, or morbidities. And so
Yeah.
so they are either hypertensive or they have depression and other conditions. And we see that when we treat their sleep apnea, we actually improve other health
Okay.
outcomes that they have.
That's good.
And we work together with the PCPs, the primary care physicians
Yeah.
at the Hope Clinic, and we get referrals from them. And 4 years later, we now have two physicians that see patients. We have a group of respiratory therapists
Wow.
who are helping patients adhere to the treatment. And we have amazing partners in the community and in the industry that help us with devices for either diagnosis of sleep apnea and also treatment of sleep apnea. So we rely on donations as well.
Yeah. That's amazing to hear. I think that was like really my most what I was most curious about and what I really want to talk about today. So,
Yeah, there's a second clinic that was
okay.
opened after we opened in Northwestern actually area in
Oh,
Chicago, and
yeah.
they modeled, I guess, their clinic based on our care.
Yeah.
We're these days working on opening a second location in Warren,
Okay.
Michigan, and
Okay.
hopefully it will go through.
Yeah.
And the goal is that every metro area in the United States will have a free sleep clinic, because
Yeah.
if you treat sleep, you treat a lot of different things in a person's life. You treat their
Yeah.
health, but you also treat their quality of life, their
Yeah.
social lives, their happiness.
Yeah. That's amazing. So, I guess continuing on this idea of large scale impact, when you're working on epidemiologic studies, how do you try to ensure that these findings can translate into changes for these individuals?
That's a good question. I do a lot of speaking on a community.
Okay.
Speaking to someone like you
Oh,
is
yeah.
also one of the ways to do
Right.
it. Going to speak in high schools, talking in community events. Middle schools have symposiums for mental health, so I would go and talk there.
Okay.
The sleep clinic is a way to do that. Education of physicians, primary care physicians, making them know about our service, being interviewed in different media channels. So these are the ways that we do. We bring our research findings into the community.
Yeah, that's amazing. I think that connection is always super important, and it's great to see like all the stuff that you're doing for that. So my next question is supposed to be a little more fun, but if you could wave a magic wand and change one policy or practice at the University of Michigan to improve sleep immediately, what would it be?
So I wouldn't say University of Michigan. I would
Okay.
say all colleges and
Okay.
all universities around the country.
Yeah.
I am mortified by the the how do you say that when during the exam time, the exams time, the final exam time, how libraries are open 24/7,
Oh,
how students don't adhere to sleep hygiene during that time, trying to cram into exams for the last minute. I
yeah.
think that this is a really bad thing because you need a good sleep for memory retention, you need it
Yeah.
for focus, you need that for feeling better and to feel refreshed and to do well in your exams. And so the fact that libraries are open 24/7, the fact that they can eat 24/7 because there's a lot of food offerings during that. So
Yeah.
basically creating an ongoing period of being awake for hours and hours is very unhealthy. And I wish that they could change that. I remember that I was visiting one college in New York during exam time, and I saw the dean and the assistant dean serving pancakes at 3 o'clock in the morning to college students who are studying for final exams. You're not supposed to be eating at that time. You're
Yeah.
supposed to be sleeping,
Yeah.
getting your brain the rest
That's
that they
funny.
need so
That's really
you can
funny.
perform. And they were actually bragging about that. The other thing that I saw
Yeah.
is another college. I saw that they have an ice skating rink and
Yeah.
they keep it open 24/7. No, 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 no. Accidents. When
Right.
people don't sleep, they can
Yeah.
be, they're more prone to accidents. And so I don't think that those policies should be continuing. I think that they should be um, completely discontinued and let people, students, have a good night's sleep before they
Yeah.
take their finals.
Yeah. And I guess I'd like to add a comment here too. I think what you said is completely true because I think it's also important to understand that it like normalizes that kind of thing, especially when the libraries are facilitating that, right? When all your friends are up all night, it might even if like you want to adhere to sleep hygiene, you might like be influenced by peer pressure, societal like expectation, right? At the end of the day. So I think that kind of like systemic policy change would be super cool. But
There's a very famous study.
yeah,
I think it was done in Berkeley.
okay.
And they looked at the students' performance after they were sleep restricted. They restricted their sleep
Okay.
time. And
Yeah.
so they look at their performance and they ask them about their perception about performance. So they thought that they did well and they aced the exam, but in
Oh
fact they
yeah.
didn't.
I know. Yeah,
So
yeah.
yeah, distorted
Actually,
perception and performance is
yeah,
a
yeah.
consequence
I
of
think in my last two interviews, actually, the idea of perception and people thinking that they're completely fine or that they're doing great, and then the reality being very different is actually an idea that's been coming up a lot, especially with like
absolutely.
school schedules and I guess college students too. So my next question kind of follows this up because obviously it's difficult to implement these kind of policies, right? But what is one evidence-based tip that you would have for people that they can implement today to improve their alignment with their circadian rhythms that doesn't require a policy change, but rather a decision that they can make?
Discipline, it requires discipline.
Yeah.
Minimize social jet lag. So, social jet lag is when you have a very irregular sleep. If you can
Yeah.
regulate your sleep and go to bed within 2 hours of the bedtime every day. So, for example, if you go to bed at 10 or 11 p.m., don't go to bed more than 2 hours after or before. Keep a regular sleep and wake schedule. That is the best thing that you could do. Keep yourself away from screens and
Yeah.
artificial light before bedtime. Expose yourself to natural
Yeah.
daylight during
For
the
sure.
morning. That's the thing that I would say would help the most. Every person is different as far as sleep needs and how long it takes them to wind down and what takes them to wind down. So I would say know who you are and try to fine tune your optimal sleep habits so you can maximize your sleep health and feel much better the next day.
Yeah. So this is kind of a mini follow-up question. So this question is kind of geared toward teenagers with early school start times.
Mhm.
So one of the things that a lot of people my age do, and myself included, is we try to catch up on sleep on the weekends, and maybe we sleep in a little bit on Sunday mornings. So what kind of advice do you have for this kind of technique? Is this something that I can continue doing, or is this something that I should change or restrict? What is your kind of perspective on that?
I'm not a big fan of that. There's different mixed findings about this catch-up sleep. It may be beneficial for obesity, but I don't know how good it would be for mood disorders. I
Yeah,
would say if you could try to get, so I don't know how much time you need per night, but the recommendation is to have on average 7 to 9 hours
right.
for adults. So if you can do it seven, try to get those 7 hours during the night. And not, deprive yourself and then get to the weekend when you're so exhausted that you have to make up for this lost sleep. Um, Sleep is not like something that you can save, like money in the bank. Yeah, there's no saving accounts for sleep. So either you have the right amount of sleep or the optimal amount of sleep that you need for at that night, or you can't make up for that. That's how I believe it should be. Now, as far as school start times, obviously we don't have a lot of influence on that, but
Right.
we can influence the bedtime.
Yeah.
So good sleep hygiene and trying to go to bed earlier
Yeah.
so you can start a day fresh would be great. Sometimes school allow you to start an hour later.
Right.
With electives, you can take an online
Yeah.
class, or you can I don't know find a schedule of
Yeah.
athletic activities that would work with that. So
Right.
it requires some effort, but I think that it's doable.
Yeah. So the next question is kind of looking ahead into the future. What excites you the most about the future of sleep and circadian research in the next 5 to 10 years?
Yeah, so I think that those wearables are very
Okay.
exciting to me.
Yeah.
Having a wearable device or an app that can record your sleep for days and days and days at a time, or maybe months, is very exciting because when we collect data about people's behaviors, we can look at seasonal changes within the
Yeah.
person. We can look at age-related changes. We can look at if we think about students, we can look at the semester versus the summer break. And so this can tell us a lot about the person's um, sleep patterns. So we're very excited about that, especially
Yeah.
when you look at let's say, women during pregnancy and then after delivery, postpartum. There's a lot of information that we don't have continuously that those devices would allow us to have. That's very
Yeah.
exciting to me.
So on that note, thank you so much for joining me today, Dr. Dunietz. It was a pleasure speaking with you, and I'm so glad that you got to share your perspectives and your thoughts on sleep and the direction it's heading in the next couple of years.
Thank you so much.